Hello everybody, hello everyone, and welcome back again to my channel. For today's video, we're going to talk about the NCLEX prioritization and key points and techniques on how to answer these very tricky and very important topics in NCLEX preparation. So NCLEX prioritization is very important because you're going to analyze, you're going to decide which of the following questions need to be prioritized or need to decide which are important for the care of the client. Okay, without further ado, these are the key points and techniques that we need to understand. Okay, of course, the never-ending ABC is very important, and when we include the D, E, and F. Now, A stands for the airway. That's a priority, of course. The breathing, they are always together. If the airway is compromised, breathing as well is compromised. So that's why they always be together. Now, circulation is if any, those who are in bleeding, of course, we had to seal that bleeding so we prevent shock or client will be in trouble. Okay, then the D is a discomfort or pain that the clients, and education or teaching, and as well as the emotional stability of the clients. So to prioritize, of course, the A, B are the important, the airway and the breathing, just in case they are not there. So either the circulation or pain should be prioritized rather than giving teachings or provide emotional stability for the client. Okay, so that's one point. The next would be emergent, talking about who needs most, who needs a special care or attention. Check on the questions or the scenario that the NCLEX is giving to you. If you think that this case is the emergent, then you have to choose that answer. Okay, don't forget about emergent. Okay, who needs most for the client, that will promote their life and safety. Okay, then age and gender. Okay, now age and gender doesn't matter, it doesn't count. Don't look at it because they are only like to confuse you, so don't look at it. It doesn't matter. What is important is the scenario that is asking on the question and what's going on. Is that scenario would lead to compromise the client, and therefore that's your priority, not the age or not the gender of the client, if that's male or female. Okay, whether they are young, whether they are old, everybody is equal, so check on that. Next, save life first. Of course, life is important. Okay, now for if you think that the client is in danger of life, you need to prioritize that and you need to select that answer. Who needs the most attention to save life? If you think that the symptoms, or on the scenario that the symptoms is compromising, then therefore, or the client is in danger, so that's your answer. Don't forget about it. And if life is imminent to get lost, okay, save life first. Okay, next, critical condition. Now, what is critical condition? Those clients who have the worst condition, remember, that could end their life. Check. Those clients who are very sick or who had the worst injury, okay, or who has the worst complications. Okay, remember these keywords. So if the symptoms is a complication, or you think that in the future, or you assume that the client has this kind of complications that might occur in the scenario, then therefore that's your answer. Okay, think on that. Okay, check on that. The next would be who needs to report first. Okay, it means who needs to be given a priority attention, okay? Client that needs special attention. Okay, unusual. Remember this. This is also important. Unusual or suspicious symptoms on the scenario. If you think that this is unusual or suspicious symptoms that could be reported to your supervisor or to the doctor, then therefore that needs to be prioritized. Okay, and sorry for that. Client needs special care, okay? Of course, always a special care for the client, okay? Check on that. Next, diagnosis, okay? If on the scenario has a diagnosis, for instance, client has an asthma, the client has a Parkinson's disease, the client has a stroke, so that's a diagnosis, okay? Expected symptoms versus your unexpected symptoms, okay? Now, if on the diagnosis it say expected of the disease itself, then that's not your priority, okay? Remember, okay? And if on the diagnosis it says that the client have unexpected symptoms, of course, when you say unexpected, that could lead to complications or things that, or symptoms that might cause the client's imminent danger of her life, then therefore that is unexpected symptoms, therefore that's a priority, don't forget. Okay, expected outcome of the disease, okay? It means if that is an expected outcome of the disease, that's not your priority, okay? Okay, like for instance, the client has asthma and sitting, and the client had difficulty of breathing, okay, but he's okay, and you check that the oxygenation is okay, then therefore that's an expected outcome of the disease, but that's not your priority based on the scenario. If there are other diseases that on the scenario that is important on the client with that asthma, okay? So remember, those who have the complication and unexpected symptoms, those are prioritized, okay? Complications of the disease or the diagnosis, remember that is priority, okay? And these are worsening symptoms. If that is a worsening symptoms, then that's also a priority. Remember that. Check. Okay, next, assessment data. Okay, now the assessment data, check and look for the symptoms on the scenario of the questions provided on the question, okay? Check and look for the symptoms. So that's why in prioritization it's very important that you know your content. That's your saving grace. Remember that. Don't go on the battle without understanding those content, okay? If you don't know the disease they were asking, you're gonna lost, and they will give you a lot of questions on that, and then you will fail. Okay, what's going on? What's going on, my dear? Okay, on the assessment data, check. Always check something that is unusual, something that is complications, that is something unexpected, something that is worsening the symptoms of the client, and therefore that's going to be your answer for prioritization and then your assessment data. Next, Maslow Hierarchy of Needs. Okay, remember, Maslow physiologic needs is the first one need to be prioritized, okay? So because if you did not able to complete this, therefore the client is in danger, okay, rather than the following. Okay, remember that Maslow Hierarchy of Needs are the PSLSS, okay, the physiologic, safety and security, love and belongingness, self-esteem and self-actualization, okay? But in Maslow, you have to consider the physiologic needs just as like with the A, B, C, D, and F, so you need to prioritize that. Next, safety is the best policy. Always remember that safety is the best policy for the client. Of course, always ensure safety at all costs and at all times. So that will be your answer. And promote willful life of the client. Of course, we're here to save lives for the client. We're a hero on our own way. Then know your normal values, so your laboratory abnormalities. Know the normal if they deviate. Therefore, are those values would lead to complications that will lead to client that would have unusual symptoms, and therefore check on that too. Okay, because that would also the answer. Okay, deviating from normal values needs most care. Okay, so if you can check on my video for normal values of laboratory and as well as indication if they increase or decrease. Check on that. Okay. Okay, then sample question for the priority. Let's check if you understand. Okay, who needs priority first? Hey, okay, 1, an asthmatic client sitting in a chair. So if you will think that they have a problem with the ABC, okay, but it's asthmatic and it did not say anything of scenario, so therefore, so it's just sitting there, so it might not be our answer. Client with gastric ulcer with melena. Probably a complication, or is this a complication or it is a usual symptoms? Probably this is a usual symptoms, okay? So with gastric ulcer, bleeding, and that will lead to melena, okay? Client with head injury with head bandage for wound, okay? But it did not say, is this client is a priority? Well, it already had a head bandage for wound, but it did not say anything. So there are no symptoms that are unusual or changes in behavior. So that's not our priority then. Okay. Then, therefore, the last client with influenza turns combative. Okay. Now, the client with influenza, like they have the flu, and suddenly it turns combative, like there are changes in behavior, he's fighting for his life, or probably the airway or breathing is a problem. So that's why this will be our priority, because combative means like there are unusual symptoms, there's a complication of that, so that will be our answer. So that is your number 4. Okay, you got it? Okay, next, there will be another one sample. Okay, this one. Who needs priority care first? Okay, a 25-year-old male. Now, this one had an age. 25-year-old male with abdominal pain, nausea, and vomited 3 times. Ooh. But there's no diagnosis yet, but there are symptoms here. Had abdominal pain, nausea, and vomit. So you think this is a priority? Okay, next. Let's do it first. 45-year-old with swollen ankle and fever. No diagnosis yet, but swollen ankle and fever. 12 years old with multiple bruises at arms and legs due to fall. Okay, and 4-year-old with fever and nuchal rigidity. Something is going on. Okay, now first. 25-year-old male with abdominal pain, nausea, and vomited 3 times. So, since 25 years old, they are more stronger and vomited 3 times. They're not a risk for fluid and electrolyte unless he vomited 10 times. It could be, but 3 times is not. So, we're gonna X on that. That's not our priority. 45-year-old with swollen ankle and fever. Okay, now fever doesn't say how specific. A swollen ankle, 45 years old with swollen ankle, so it's a little bit less complicated. It's not like dangerous. It still can survive, not our priority. 12 years old with multiple bruises at arms and legs due to fall. So we might presume that the client can roll over or like have multiple bruises, but it doesn't say anything. It only fall. Does had a changes in the behavior of this 12 years old, get unconscious. So it didn't say here. We might have a question. Now, this one, number 4, a 4-year-old with fever and nuchal rigidity. Now, thinking about the nuchal rigidity, is this a neurological dysfunction? Yes, because that would include your meningitis or something, because he had fever. So there is infection, inflammation, and declined nuchal rigidity, like extension of the trunk. That's a very important aspect. So neurological problem. So therefore, this is more specific and more dangerous for the clients and 4 years old as well. But we don't check on the age or gender, but this is more specific, and the client has complications of the fever. So therefore, this would be our priority. Okay, so you got the correct answer. That's number 4. Okay, that ends our prioritization. Thank you. God bless. I hope you learned from the techniques. Review it all again and give yourself like on way to practice. Prioritization is very important. That will be all. I hope you learned from my video. If you learn and appreciate it, please do like, comment, or share so that we could help other nurses to pass their exams. Thank you so much, and God bless us all.